Welcome back at the Dept HQ, and we have something special for you in store. I must say, this was a really, really strange year for me personally. Suddenly, I got the message you need to stay home. It's only for a couple of weeks, and they said it's only a couple of weeks more. Then they said it's only a couple of weeks more. And I think it was a good thing that they decided to stay home, but also it was really weird with my kids and my dog and the education. And suddenly I realized how important healthcare is. And today we have a very special panel that is going to talk about the future of healthcare. And to lead that up, it's Daniel, my colleague from the US. And Daniel, I'd like to ask you to introduce the rest of your panel and lead us through what's going on and what we need to do.
Awesome, Max. Thank you. Great. Good morning, good afternoon, and good evening to all of you joining us today for this very interesting and I think relevant, as Max mentioned, panel discussion that I have the great joy to moderate for you all today. A big thank you to the Next Web for hosting this incredible event. We hope that next year we can be together again in person, but we are making do, and I'm glad that we have the global reach that we do because of it. A big shout out to all the Depsters attending too. Very excited to have the opportunity to be here with you today as well. Healthcare is a topic near and dear to my heart, as I'm sure it is all of you. At some point or another, we have all come in contact with the healthcare system, and it is quite personal. A little about myself. My name is Dan, as Max mentioned. I've been in tech as a product designer for the last 10 years, and I'm now managing director at Rocket Insights, where I manage our team and lead our work with healthcare clients, which is what brings me here today. The format for our discussion will be 40 minutes of Q&A with our panelists that I will be leading, and I'll encourage you all throughout the conversation to drop your questions into the chat, and we can get to them afterwards in the last 10 minutes of the discussion. So as I mentioned, the healthcare industry is facing a major moment in history. It's growing. Innovation is rapidly accelerating, largely due to the pandemic our world is currently facing. With me today are three panelists, tech healthcare titans, that are very well suited to discuss these topics, and I'm excited to hear from them. I am not going to introduce them. I'm actually going to ask that they introduce themselves. I'd love to start with you, Ashima, then I'll pass it to Adam and finish with Hans.
First of all, thank you for having us here. It's truly a pleasure. And yes, we're all dealing with this digital pivot. So first of all, I hope you all are safe and healthy wherever you are. This is Ashima Gupta. I spearhead healthcare industry strategy for product and solutions for Google Cloud for healthcare. In this role, I set the direction for the transformative healthcare solution and lead engagement with healthcare key executives and helping transform their business strategies that define new models for care, revenue generation, and improve patient experiences. Prior to joining Google, I was with a startup, Apogee, where I led and created healthcare vertical, big passion around open data, APIs, and I came into the startup through Kaiser Permanente. So I am from the industry where I spent several years, former head of digital health incubations at Kaiser Permanente, launched diabetes management, remote monitoring back in the day, and truly a pleasure to be here. I also serve on the board of HIMSS, and looking forward to this riveting discussion. Thank you.
Thank you, Ashima. Adam, could you please introduce yourself?
Yeah, hello everyone, and it's really a pleasure to be here and have an opportunity to speak to this group. My name's Adam. I'm the CEO of Pathcheck Foundation, and Pathcheck is a nonprofit that spun out of MIT in March. And we came together in order to develop a digital pandemic response and figure out how we can create technologies that can support the containment of the virus, the revitalization of the economy without sacrificing privacy and personal liberty. We were able to build on a lot of the innovations that were done at several labs at MIT in this area of privacy-preserving healthcare strategies. So we grew very quickly. Today, we're over 2,000 volunteers around the world, a core team of professionals from the software and the health and public health communities, and we're launching applications for exposure notifications in countries and states all over the world.
Awesome. Thank you, Adam. Hans, please introduce yourself.
Yeah, thanks, Dan. Hello, everybody. My name is Hans Notenboom. I am Tribe Leader, Platform Experience and Conversion at Philips. I'll explain in a minute. Philips, you might know as a company from the light bulbs or maybe from television, consumer electronics. But actually, the last 10 years, we transformed ourselves into a health tech company. And that transformation is also the moment when I joined Philips. So I've been there about 10 years. I don't have a medical background myself, but I have a more digital background. And I've been fortunate enough to be part of that transformation, which is not just transforming the company, but also at the same time, you see the digitization of healthcare happening. So we're close to that as well. And then at the same time, we are going through what is called an agile transformation. Hence my title of Tribe Leader, which is an agile term. And I'm managing a team that manages our websites, our e-commerce platforms, and our customer portals in Philips Healthcare.
Thank you, Hans. What a great panel we have. So many different varying perspectives from different parts of the healthcare experience. So thank you all for being here today. Hans, I think that's actually a really good segue into our first topic that we'll be touching on, which is digital strategy. What does that look like today in an ever-evolving landscape? You mentioned that you've been with Philips for quite some time now, and you have experienced some of that transformation that has essentially seeded and led up to what we're facing now during the pandemic. I'm curious to hear about that strategy at Philips and how that has evolved.
Yeah, it's definitely interesting times these days, but it is not something that, at least the digital transformation in healthcare is not something that happened overnight just because of this situation. It's been ongoing for quite a while. You see differences per market. We're a global company, so we see those differences. But in general, you see that healthcare itself is digitizing. The devices that are used by, for instance, hospitals are getting more digital. The data that is coming out of those devices is shared more commonly. And as a company, we need to adapt to that. But also the way hospitals and healthcare organizations would like to interact with vendors like ourselves and partner with us is getting more and more digital. So obviously e-commerce, quite common for a lot of people, but in healthcare, it's not so common yet. And we're going through that transition that customers, hospitals can order. In the future, maybe things get even more automatic where devices themselves can order stuff, but at the moment we're in that transition to support our customers with portals. And in the situation where you see COVID, for instance, popping up, you see that we need to step up as well in the way we support our partners with information, and that's where you actually see that digital really works, because you can quickly adapt to the changing needs. To pick an example, we've seen that our customers were asking for information on how to deal with the cleaning of machines in this COVID situation. We, for instance, produce ventilators. Cleaning them is really important. So in that moment, we had to quickly adapt and make sure that digitally that information is available to all our partners. So it definitely accelerated our digital transformation, but it's been going on for quite a while.
That's great. It's interesting you mentioned, I think, the Philips business model. I think that there are different stakeholders throughout that experience, a B2B2C model, essentially. I'm curious, you had talked about, I think, your perspective along those lines. Adam, I know that Pathcheck's model is a B2B2C, essentially, model as well. How has the last 6 months sort of evolved your perception of those consumer needs and how you're meeting those needs?
Sure. I think, looking at this area of sort of COVID pandemic response and how communities are handling it, one of the first pieces for us is really clear is that this is a multi-sector problem. And everywhere we work, we find that you have to bring together private sector entities, employers, businesses, schools, public sector. And it's not just public health. In every government we work with, it's public health, it's policy, it's IT, it's multiple functions coming together as part of this response. And then community members. And within communities, it's sort of an obvious thing, but it's worth stating is that we're not all the same. There's the way this disease is moving through our population has differences, and different communities are affected differently. Different communities, from our perspective, have different access to technology, and so it's not necessarily a one size fits all. So for us, that's translated in a couple of things. One is we've really tried to build an approach to adapt to the needs of different communities in different jurisdictions. So right now, the technology that we work with the most is around exposure notification, and that needs to be authorized by Google and Apple to be used in each country or state. And because of that, we build a global network of solution providers, as an example, and we're working to rapidly expand that around the world. Because while we have a core open source project, we know that technology needs to be adapted to the unique needs of each country, and the people best suited to that are the application development firms that work in that country already, that have the connections and relationships. So, that's one example of adaptation. I think another example of adaptation for us, and I know we're going to get into it a little bit more in the conversation, is around privacy. And I think one of the things that we've seen here is that the strong role that governments are playing in this response has shifted the expectation that all of us have about how our data are handled. And I think we've seen in some regions of the world, because of the nature of the political system, we've been able to, those countries have been able to mobilize responses that are not preserving individual privacy. But in many parts of the world, we think that is critically important in order to preserve our democracies, in order to preserve individual liberty and freedom. And so that's, I think, another thing that's at play here. That's a really, really interesting and important trend.
Fascinating. Yes, Ashima, in a Forbes piece recently, you wrote, or you said, excuse me, of course, the capability to quickly spin up new use cases in a moment of global urgency was in many ways seeded by the march of technology over the last several years, because modern software is built around technologies such as APIs and microservices. Individual functions, services, and data sets can be modularly recomposed and connected without starting from the ground up. I'm curious to hear more about this march of technology the health industry has seen in the last few years, and why that was critical in helping us now move so quickly when the pandemic hit.
Daniel, that's an excellent question, and kind of ties back to what Hans was saying about digital transformation. What we saw in past 5-6 months, the industry has really progressed 5-6 years. And technology has a role to play, the infrastructure has a role to play, but also a lot of impetus from regulation. So the environment, the purpose of and what COVID created was a sense of urgency. Just talking strictly about technology and digital transformation, in my role, I have the privilege to talk to many of the C-suite in the healthcare and how they're thinking about responding to COVID. And the way, if I have to lay down the digital transformation for the industry, it comes down to like 4 buckets. Number one is digital care delivery or the virtual contact. We all saw with the lockdown, people were not able to visit their doctor. So there was a strong pivot to become the virtual first digital care delivery. So when patients no longer can go see the doctors, what is that virtual contact? Now, there were patient portals, but they needed to connect to the back end. So that virtual care delivery is the first aspect and key pillar for the digital transformation. And within that, there's a digital front door. Like people come through many doors, and there's still debate in the healthcare circle how many doors there are. But digital front door means how do people interact digitally with your company? And that's now going to be the way to compete in the digital pivot. How can you make the patient experience better? So we see a lot of efforts in that digital care delivery. The second aspect of digital transformation is the operational excellence. Because we saw some of the sectors, especially providers, they had a lot of furloughs, and out of according to American Health Association, hospital systems are losing around $50 billion a month. And that puts the strains on the resources of the workers. So is there a room for automation? Is there a room for improving the backend processing? And we see some of that, especially technologies like NLP, technologies like document understanding, to be able to help augment humans. So that's the second pillar. The third pillar, which is to really tie back to your question, is around digital infrastructure or digital foundation. Many of the systems had already well on their path, that API microservices, and they had a robust platform and various degree of maturity, which was already present, or this platform and may have the APIs, have the microservices, so you can bolt on different experiences, be it digital care delivery, be it the operational excellence. And now you're thinking, how do you augment that digital foundation with even digital innovation factory, meaning a way to really bring in new innovation very, very quickly. So those three pillars is how industry is thinking about the digital transformation, and having that foundation, having the digital infrastructure, help speed up the digital pivot, if you will, for the industry at large.
Absolutely. No, that makes so much sense. I think, Adam, you have been someone who has seen that those infrastructure changes in such a way that has, I think, made Pathcheck pivot in various different ways. I'm curious to hear how you have adapted to the infrastructure landscape as it has evolved in response to the pandemic.
Yeah, absolutely. It's a good question. I think one thing to think about first is sort of what has remained constant and what has shifted. And for us, one of the core things that's remained constant is being able to take advantage of the innovations that have happened in the last few years around privacy-preserving strategies. And one of the things that we've all taken for granted, I think, that if you want to use a mobile experience, if you want to take advantage of one of the myriad of services, you make a trade with technology companies, and that trade is they get your data. And they get a lot of data about you. They get data about where you go. They get data about what you buy, what you talk to, what you look at, who you're friends with. And I think when we looked at what was happening with this pandemic, we said, that's not going to work. If we have to ask every person who has a mobile phone, 3.5 billion people, to tell their government who they met, who they were next to, where they've been, everywhere they've gone, no one's going to buy into that. It creates a level of state surveillance that's unacceptable. I think, really anywhere and in many, many individual countries. So a through line for us has been using advances in computer science, and those are advanced technology strategies, but also privacy by default or privacy by design patterns that we've applied. So we started first off very early on with the very first application that was released for digital contact tracing. And at that time, the only sensors that we really had good access to were the GPS sensors. And so we designed a system called Safe Places that used GPS data. And that was useful, I think, really important for digital contact tracing. But I think the work that we were doing, helped to sort of feed into the dialogue in the larger industry. And Google and Apple developed a way to take advantage of the Bluetooth radio within the mobile phones and built into the operating system a new set of APIs that they're only making available to governments. But those APIs allow us to detect when people have been in proximity with each other. And so that was one of the key shifts that we made, was to embrace that new framework. And the reason we did was because it was deeply privacy preserving. There's many different ways in which they've applied the technology. So it's anonymized, it's encrypted, you never share data without consent. Only a small number of people have to share data, and those are people who've tested positive. Everyone else keeps their data on the phone. analysis is done in a decentralized way rather than a centralized way. And this, I think, will be the first time that these, privacy preserving technologies have been deployed at this scale. And that's what we think tremendously exciting, because on one hand, we're able to actually directly impact the course of the pandemic. Oxford University has estimated that if we can get to 60% adoption, we could stop spread. And even at lower adoption rates, we have a material impact on the spread of the disease and mortality. So that's super exciting, but we can do that without sacrificing all of our data, without giving all of our data to the government or to another technology company. And so I think that's, so that's been sort of, we've had to pivot a couple times to respond to the changing landscape, but we've also been able to, I think, pioneer and drive forward technologies that make sense. And we've been able to do it in just great collaborations. We, in addition to the mobile phone level technology, Google's leaned in and volunteered their teams to build all the server side functionality that's necessary to do this. And they've done it in an open way. So it runs on every cloud. And without that, we wouldn't have gotten where we are so fast. So I think it's an awesome thing to see. We think of this effort as an alliance effort, right? It's an effort where many technology companies are coming together and many solution providers are coming together, kind of putting their best minds and their best capabilities to make this happen, focused on the impact on communities.
And I think privacy preserving is the key word, Danielle, and this is critical to us from even when I wear the Google Cloud hat, and this is our commitment to the data privacy and security tool for our customers. We understand the data is critical, just like from a consumer perspective, even from the business's perspective, it is their lifeblood. The data is critical, and we take great care to keep it safe and under their control. And we believe the trust is created through transparency, and we want to be transparent about our commitment. And our commitment, we have 6 trust principles company-wide that we follow from a cloud perspective. You have full control of your data. Your customer data is never used for advertising when you put your data in the Google Cloud. And there's full transparency where your data is stored, which region, because we know data residency is an important aspect of that too. And then it's not just me and Ashima saying that. We have independently verified security practices, different audits that we share the reports with. So it is critical to us how to help businesses around the world in a privacy preserving way to feel comfortable about coming to Google Cloud. And those trust principles, we openly share them. They are on our website. So it's critical. And as Adam said, we've also we have seen that need for it even in the consumer space, especially with the privacy, the notification aspect of that as well.
And maybe to build on that, at first I wanted to say that luckily we at Philips are not in a space that sensitive as the scenario that Adam just described. But then it started me thinking that actually we are in a regulated industry, and privacy by design and security by design need to be in there and are in our DNA already from the start onward, because when it comes to it, we are dealing with medical data. We are even dealing with data that can influence people's lives. So we are luckily in a regulated industry, so we need to make sure that all of those principles are adhered to and deliver the solutions that follow those guiding principles of privacy and security to the maximum.
Yeah,
encrypted at rest, in transit, and new innovations like confidential computing. So data is even encrypted while processing. So a lot of new innovations coming this way. There's that common understanding, especially from the healthcare, but all the regulated industries, fintech, and there are many industries who rely on this, who are regulated. There's the need for confidentiality, encryption, and technologies do exist to support that. And as I said, from cloud perspective, those trust principles and our commitments are very important to us. And Adam, I've started to love this term, privacy preserving way. And it's critical to our customers. We hear that all the time, and when we are here to and committed to support those.
It's really great to hear. I think that's a fantastic segue to our next topic, which is exactly that: privacy concerns and user expectations. For health plans, hospitals, and health systems, 2020 has been likened to the year of the consumer, or at a minimum, the year of greater consumer influence. And it's actually, I think, something that we are all starting to see, that consumers are no longer passive participants in the healthcare process, but they're demanding transparency, convenience, access, and personalized products and services. And in a healthcare industry where those, I think, key performance indicators have lagged, this is something new. So Adam, I'm curious, many consumers still have major privacy concerns when it comes to their healthcare data. And I think it's interesting to talk about, the guiding principles of an organization, but what are we actually doing to address those privacy concerns, and what will this look like in the future?
Great questions. So let me talk a little bit about specifically what we're doing with exposure notification, and then sort of expand that out, because I think one thing to keep in mind is that health data is a really broad area. One of the companies I started a few years ago, we were working with whole genome data. And whole genome data poses all kinds, they talk about like very personal piece of data. Your genome is a really personal piece of data, and who has it and who can use it are really complicated topics. So this is an extraordinarily large span of different kinds of data that we might think of could be collected about people. So let me talk first specifically about exposure notification. So everyone understands exposure notification is a technology that allows you to detect whether or not you've been near somebody who has tested positive for COVID-19. The power of that is that you can think about it as a sort of complement to or enhancement to what sometimes people call contact tracing. And fundamental sort of to containing the pandemic is the process of testing, identifying who's been exposed to people who've tested, and then having those people self-quarantine or isolate themselves. That's like how you disrupt the spread of the disease. You stop it in its tracks. And we did that in many countries in the spring, but we did it by having everybody go home. And the concept here is, instead of having everybody go home, you just have the people stay home who've been exposed. The trick is doing that at scale, right? So contact tracing manually worked really effectively for infectious diseases like HIV/AIDS. It worked well for Ebola, but these are diseases where spread is relatively difficult. With COVID, you have spread by droplets, you have aerosol spread. It's much, much more widely distributed in the population already. So exposure notification is a way to take advantage of the fact that there are 3.5 billion mobile phones in circulation, and we can use those phones to detect whether or not people have been near each other. So that's a really powerful technology. It's just being rolled out. Most jurisdictions don't have it yet, but over, I think, the next 2 or 3 months, we're going to see it roll out very fastly. My prediction is that by January, there will be more than 1 billion people who have exposure notification running on their phone, which will be one of the fastest rates of adoption for any kind of a mobile application ever. So the question for us there is, you've got this really specific thing that we're trying to do, and can we convince people that it's private? So I think that translates into some really specific ways in which we've implemented privacy by design. And I mention them because they're illustrative of things that we can apply in other places. So the first one is just, it's anonymous. You're never required to enter any de-identifiable information about yourself. You're never asked for what sometimes people call PII, personally identifiable information, like name or address or phone number or email. So right off the bat, you have an application with no sign-in, with no identification of who you are. That's a pretty good start, right? The next start is that the data are primarily kept locally, and those data are highly anonymized. So the way this particular solution works, when phones are near each other, you're constantly broadcasting an anonymous ID, a number. And it changes every 15 minutes. So it's pretty tricky to trace back to you, almost impossible. And you're listening, so you're collecting. Essentially, you have 2 diaries on your phone: a diary of all the numbers you've broadcasted, all the keys you've broadcasted, and a diary of all the keys you've heard, right? Those are encrypted on the phone. They're totally anonymous. They're not connected with you as an individual. And then if you get a positive test, you can choose, and this is a third pattern. So you have one pattern, no PII. You have a second pattern, data encrypted on the phone. You have a third pattern, which is consent. So you choose actively whether or not you share your data. They're your data. They're not anyone else's data. They're not the state's data. They're not Google's data. They're your data. You choose to share them. And all you share, if you have a positive test, is essentially a list of anonymous keys and a little bit of telemetry data about like Wi-Fi, about Bluetooth signal strength, right? So no information about you actually gets shared. And then what happens is that those data are aggregated with everybody else who's shared their positive keys and sent back out to everybody. And this is the third pattern that's really cool, which is a form of decentralized computing. So what's happening is normally, like, for example, if you think of a GPS-based system like Uber, where you tell where you are and the driver tells where you are and everybody tells Uber, you know, and I don't want to sort of specifically criticize Uber, I'm just pointing to it as a pattern. All those data are centralized in one place, and that one company can see everything. But in this pattern, you keep your data about which keys you've heard, essentially which keys your phone has listened to, and then you download the list of positive keys and an algorithm runs on your phone. So the algorithm isn't running in the cloud, it's decentralized, it's running on your phone. And then it tells you, oh, it looks like you've had a match here. It looks like you've been exposed. So what you've seen there is 3 privacy-preserving strategies deployed. Now there's four. And there's a 5th one that we're about to do in partnership with Google, which is super exciting. And one of the things that we want to be able to do is analyze some of these exposure notifications. So what we want to ask people, again, to consent to do is to say, hey, your phone did an algorithm, and it identified that you had an exposure, call it an exposure notification. But there's some really interesting information from an epidemiological perspective about the fact that you got that. So we want to be able to analyze that, but we want to be able to analyze that in a totally privacy-preserving way. So we're using a strategy, a computer science strategy called multi-part computing that allows you to do machine learning on data, but without, essentially without de-identifying that data. And I won't get into exactly how it works, but suffice it to say, this is a technology that's sort of kicked around the computer science labs for a long time. It's never really been deployed at this scale, and we're just starting to put it in place. I think what's exciting about this, you asked about kind of where the future is going with this. And I think the exciting thing here is that we're having an opportunity to demonstrate at scale that you can use these privacy-preserving design patterns and computer science strategies and technologies to have a material impact on healthcare. But those same patterns and those same strategies can now be applied in other areas. And I think we'll start to see that. And I think consumers are going to learn. We're going to have, billions ultimately of people using these applications. And I think they're going to start to ask themselves, well, wait a second, why can't I do similar things with other data? Why do I have to share all my data to get all these wonderful positive benefits from this service? And I think that's going to be really exciting and transformational. And we'll start to see this play out in healthcare in other ways.
That is awesome, Adam. Thank you for sharing. It looks like you wanted to respond.
Well,
Okay, sorry. No, I didn't mean to put you on the spot. Although that
I 100% agree. I think consumer trust depends upon do we empower them, the transparency and consent. So from where I sit in the position I have, we are looking into, and we are actually that part of our product portfolio, consent API, de-identification APIs, and because we know that for us to advance the consent API, giving that empowering the consumer, being transparent about it, and giving industry the tools like DID so that you can take a chest X-ray as an example. Today there's PII embossed on it. We have built the technology where you can actually take that PII off. Now, why it is important? When you are building an AI machine learning model, what we hear, like let's say you were to develop a model to detect the lesions based on the images, it takes that, taking that PII off, those images, a hospital system can feel comfortable training and developing a learning system to learn from the patterns and apply. So it's not about knowing the date of birth, the name, and the address of the person. It's about that, that image, the size of the lesion, and learning from that. So we believe technologies like de-identification, consent are critical to developing really building the AI machine learning models that are, so critical as we push healthcare forward.
Thank you. This is really meaty. I think a subject we can talk about for a while. But I think I do want to touch on our last topic before we open up to Q&A for the audience, and that's the future of healthcare and tech. I think, Adam, you started to talk about that from a privacy-preserving perspective. I'm curious to hear, Hans, from you, what are the trends that you think the healthcare industry will see upcoming?
Yeah, what I liked about Adam's sort of provocative statement is, what does all this learn us for the future? And I think there are a couple of trends that were already happening that I think will accelerate now. One of the trends, if you will, is moving care to lower cost settings, maybe even to the home. And with this type of new technology and the way people interact in these cases, I think we could see an acceleration of that. There's definitely an increasing need to be able to do things from your home. So home care and also connected care and telehealth as the whole domain, I would expect we see an increasing rise of that. Another element that we see in COVID, which was already happening in the healthcare industry, is this need for care coordination. It's not just about one treatment for one person. Actually, healthcare is about a connection between many different people that need to work together to help a patient. And care coordination, I think, is another area where there is a need for interconnecting, for sharing the data. And if you then move to the third big one, I think with what's showing here is an increase of data, which was already actually happening within the healthcare industry. The amount of data that's available is rapidly increasing. The digitization is helping with that. If you look at an MRI scan today and the amount of bits and bytes that actually that reflects is so much more than what we had in the past. And that's just one small example. So I think there is an enormous opportunity to find ways to leverage all of that data, to connect it smarter together, and to use that for better care coordination, and also maybe for moving care to other settings like the home.
Yeah, I think I'll jump on this, Hans. I think we see that a lot, the right care for the right patient in the right setting. I think that's some of the new challenges for the industry. Right now, given COVID and pandemic, telemedicine or telehealth has become the norm. But as you look past and are getting ready for the recovery, some of that will stay, like telehealth that we did as part of this COVID-19 response to Google Cloud. We were collecting, like, how do we help the industry? And we had done the survey. Over 90% of respondents said that telemedicine is here to stay, and it's not like perishable. It's not just for the pandemic. Even post-pandemic, there will be a need. And telehealth, if you think of it, as to your point, home is a hub, right? There are 4 different areas how telemedicine has been positioned. Number one that we saw during COVID is the virtual visits or the primary care visits. The second area is the remote patient monitoring, which is our disease states, be it diabetes management, congestive heart failure, or nutrition counseling, medication management. That's the remote patient monitoring aspect of that. The third is the remote diagnostics. When we are looking into the geography boundaries today, when we go to the specialists, like especially radiologists, they have an area. Now with virtual, now we are having this conference from different parts of the world. That world where you can get your MRIs or CT scans being read by the other part of the world, all digitally, that's kind of remote diagnostic, restore and forward health. And the fourth is really high acuity patients' home health, where we saw with the nursing home and the hospice, the COVID-19 had devastating effects. So we are seeing across all this, like from low acuity to all the way to high acuity, telehealth, and the many, many innovations that need to happen to really power all these 4 different flavors of telehealth, if you will. And and more innovations coming in that direction, and building that digital platform and foundation that powers all those different phases will be critical.
Yeah, and to build on that, it's not just about finding the right outcome and treating patient. It's also not just about finding the lowest cost way of doing that. We know healthcare systems are under cost pressure, so that is important. But it's also about the patient experience actually that we deliver. And specifically, if you look at home care and elderly people working from home or having treatment from home, then the patient experience actually becomes a really critical element in this. And it's not just the patient experience. I think it's also the staff experience. How can we make it easier for the people working in healthcare to deal with these situations? And then digital technologies can actually help to make it easier and more accessible and better actually to work with.
Awesome. Sorry, I want to interject. Actually, we only have a few minutes left. I know this topic is fantastic. I do want to get to some questions from the audience, though. So I apologize for the interruption. So one question that was posed is, how can new medtech companies use these changes to reshape their business models or go-to-market strategies? For example, an AI platform-based company. Ashima, I want to pass that to you.
That's a good question, and we do get approached by a lot of medtech companies. Where we have seen the traction is, it is sometimes there's one algorithm, or you're talking one disease state that's interesting. I think it's the part that is important and becomes critical is taking that model from bench to bedside. There's a lot of O gap, and I call it the operationalization gap, which is non-sexy, mundane, but also grunt work required to take that innovation. It's not just that it's showing up in the app store. How does it interact with the backend system? How is it being part of the clinical workflows? And Hans touched on that. Any new innovation, and I learned that from my tenure at Kaiser Permanente, which is the health system, physician buy-in is important. And physician, they are looking for ease. They're not looking for more data. Like, trust me when I say that we can collect all the data from the medtech device and give it to the physician. And we believe as innovator that's helpful. It is not. They're looking for insights and not looking for more digital data exhaust. So think of, how does it help the physician? Is it part of their telehealth work, or not telehealth, or any workflow that they are being part of it? So if you built a device that is, let's say, doing better ophthalmologist, or we have that, how does it interact with the current ophthalmologist workflow? Does it make their life better, easier? I think that's how we need to think about it.
Yeah, that's spot on.
Ashima, I am user-centered design. Hans, I know that you wanted to respond.
Well, in terms of business model, I think the big shift is that instead of being just a vendor to the healthcare industry where you push your product, it's more about partnership and finding ways to collaborate together to solve the big challenges that we have in healthcare. So I think that's a shift in business model that we see.
I wanted to throw in another piece on this, which is connecting also one of the earlier questions. One of the other big trends that we see happening is that we think healthcare has historically been about one person getting sick and that person getting treated. And I think what COVID has shown us that was always happening but wasn't ever so clear was that health affects whole communities. It affects whole economies. And thinking about health from a population scale and a public health perspective is a whole other way to think about health and health data. And so one of the things that we expect to have happen is that the infrastructure, the digital infrastructure that comes in place for exposure notification is going to evolve very quickly into a full digital pandemic response. And then it's going to evolve into a new generation of public health and population health infrastructure to work with. So I think that is going to open up really, really exciting and interesting opportunities for business innovation. And then specifically in AI, since we've been talking a little bit about privacy here, there's some really cool advanced approaches that are specific to machine learning. One specifically is split learning, which is an approach to analyzing decentralized data, where you can still apply some of the machine learning strategies to train models, but doing that without aggregating data. So that's just, I think, one of the examples of where, you combine that with a system for population scale health management and health service delivery. That gets really exciting.
And I think it's been pretty sobering.
I apologize. I don't want to interrupt you once more, but we are at time. And as expected, this was a very engaging conversation. I apologize for the interruption, but I do want to thank you, all the audience, for having attended. And please follow up with us to continue the conversation backstage.
Awesome.
Thank you all.
Take care.
Thanks, guys. That was one awesome talk. And again, as promised, so my takeaway is that health data, it really goes hand in hand. Obviously, we need the experts from the healthcare system, because we can do that from a digital perspective. But when we merge together, I really feel like we can do something good for the world. And actually, we really need this stuff, and we need it now. So thanks so much, Ashima, Hans, Daniel, and Adam. Great talk. Enjoy the rest of your day. And for you all still tuned in, please, if you have 15 minutes to spare, check out our playground. Right now, we are cocktail shaking. So if you want to shake some cocktails, go over there, enjoy it. Otherwise, stay on the chat, ask some questions, or maybe chill, relax, have a drink. Again, maybe walk your cat this time. And we will be back at 5 o'clock for the future of consumer goods. And there will be two great brands. SteelSeries, they make like the best gaming hardware, and Bugaboo strollers, and not the simple ones, but the really designy, beautiful stuff. And they're gonna talk together with Melissa. So see you back at 5. And for now, have a small break and see you back.
One more time, got me feeling so free. We're gonna celebrate, celebrate and dance so free. One more time, this got me feeling so free. We're gonna celebrate, celebrate and dance so free. One more time, this got me feeling so free. We're gonna celebrate, celebrate and dance so free. One more time, this got me feeling so free. We're gonna celebrate, yeah. One more time, got me feeling so free. We're gonna celebrate, celebrate.